Good evening, everybody. Let me see if I got the button right. So when your CV is not as strong as Larry Friedman's, what you do is you throw in pictures to distract. So I'm now going to begin my bio sketch with a series of pictures. So my family from generations is from, I'm distracting, is from this little island shown in the bottom right. It's that long green island between Crete and Rhodes. It's called Carpathos. It's a gorgeous island in the Mediterranean, and it's dotted with beaches that look like that. There are like 20 to 30 of them, okay? And this is actually the beach where my dad and my uncle taught me how to swim when I was a little kid. We used to go back quite a lot when I was younger. So my parents, just before I was born, moved to a different Long Island, this one, here outside of New York. And I was born just barely and raised initially in Brooklyn, New York, before, you can relate, Larry, before I moved out to the island to a place called Garden City, New York, in Nassau County. And Larry, do you know what Garden City is known for, what it's famous for? Larry's good at trivia. Roosevelt Field was the airway where Lindbergh took off for his historic flight, about 200 yards from where my house was. So that's what we're famous for. And then I moved to the other side of the Long Island Sound to Yale University, where I went to college, back to New York for medical school at Albert Einstein College of Medicine. I didn't really travel much. I kind of stayed in a little area. And then finally I took the long trip up 95 to Boston, where I did my internship, my residency, and my cardiology fellowship at Boston Medical Center, then Boston City Hospital. I stayed on staff there for about 20 years, aging myself in the coronary care unit and in the cath lab. And in 2014, had the really good luck to meet Ellen Maloney and Larry Friedman, and they gave me the dream job of coming to Newton-Wellesley Hospital, where I became the chief of the division, and I also serve, as Larry had mentioned, as the medical director for the Elfer Center, president of the medical staff, and an interim director of the medical group. It's been a busy year. And again, having just a great time, the best thing that I ever did. So that's sort of been my path here. Most importantly, I'm married to Leonore, shown here, who's a primary care physician at the BI. We have two sons, John and Alejandro, and the best dog in the world, Amanda. Somebody once told me, if you want to get good evaluations on your talk, show a picture of your kids and your dog. So when you get the evaluation sheet, please remember this slide, okay? Because the rest of the talk I don't think is so good. All right, so now I'm going to talk fast. Remember, I'm from New York, and I'm going to go really quickly through the cardiology division, not because it's not important or fascinating, of course it is, but I think you guys sort of know a lot of this. So we have very, very busy outpatient clinics, as many of you know. We have one in Newton-Wellesley Hospital, Needham, Wellesley, and a new one in Chestnut Hill, and they're all terrific. We also, as Larry had alluded, have some subspecialty clinics embedded in our general clinics. So we team up with the stroke neurologists. They see their stroke patients once they're discharged in our clinic, because we understand that stroke patients have vascular disease, and oftentimes the reason for their strokes are cardiovascular disease. So we see them in tandem or in series to make sure that it's really easy for the patients and they get good care. That sounds basic, but a lot of other hospitals, you'll see one and then wait for months to see the other, and they don't talk. We basically are working side by side. We have a robust prevention and cholesterol clinic, a lipid clinic. And this is for patients who don't have vascular disease, but they might have strong risk factors, a strong family history that's concerning, really bad cholesterol, or questions about the risk factors. And we'll see them do whatever testing they need, and then help get them the kind of the counseling they need for a heart-healthy life. I'm saving two, the ones with asterisks of our clinics, toward the end, because they asked us to sort of finish with innovations. And as Larry alluded, we have two, I think, very innovative clinics embedded within our clinics, the South Asian Clinic and our Newton-Wellesley Hospital MGH Arrhythmia Clinic, which I think is fantastic. Within the second floor, the cardiovascular world, we have a device clinic, the Briazzano Device Clinic, which is where our patients with pacemakers and defibrillators and other what we call implantable cardiac devices go to get taken care of and have their devices checked and make sure that they're doing well. We also, right next to our clinic, have a fairly large and thriving non-invasive lab. That's where you go for cardiac procedures that doesn't require a needle. So things like stress tests and echoes and monitors and nuclear stress tests, the whole array of what we call non-invasive testing that's very, very busy and quite high quality. And then, as you might imagine, we have a team of cardiology consultants who see patients in the hospital, in the ICU, in the emergency department, and sort of help manage them along with the excellent hospital service and excellent ED and ICU that we have. And that's really busy. And it's staffed for the most part by these 4 women shown here, are PAs. So we really work very closely in teams of doctors and PAs. We're sort of big believers in that team approach. And then finally, as Larry said, we have a state-of-the-art cardiovascular center, the Elfers Cardiovascular Center, and that's one of the rooms. And you can see it looks like something out of Star Trek. Clinicians who come from the general and other hospitals and do procedures here just cannot wait to do more procedures here. They say that the equipment, the visualization, the fluoroscopy is better than any place around. We share this space right now with vascular surgery, who does major arterial procedures there, with a very busy interventional radiology division, who do lots of procedures there. And the procedures that we do in this center, I show here on the left side, lots of them, including putting a lot of pacemakers and defibrillators in. Okay, so that's sort of the realm of procedures for now. I'm going to talk about the last 2 a little bit later. We also don't focus on the people who are acutely ill. We very strongly lean into prevention and cardiac rehabilitation. We have a fantastic cardiac rehab program at Newton-Wellesley Hospital focused on patients who recently had a heart attack or been admitted for major cardiac procedures like bypass or valve procedures. This is a multidisciplinary group of nurses, therapists, nutrition specialists, exercise specialists, who then get patients back to heart health. If you look at the picture shown there, and then look at the second row of the aisle here, you'll see a remarkable resemblance, because this is part of the cardiac rehab team, and also part of the team, we all work together, of a lot of our community outreach. So at Newton-Wellesley Hospital, we have a great Heart Health and Wellness Council that's part of our community outreach efforts, led by Beth Keene and Jane and John, who are here with us today. And we all work together to make the Newton-Wellesley Hospital community more heart healthy. What we have focused on over the last couple of years, we focused on a lot of things, but I think the 2 big wins, you guys might agree, is that we have focused on getting older people out of the house and more physically active by way of making their hearts healthier and their souls healthier. We all know about loneliness and social isolation in old folks that got really exacerbated during COVID. So Jane and others have done a lot of work in getting people to walking groups where we'll often join them and do sort of a walk with the doc kind of program. We've partnered with the JCC and different colleges around to get that going, and that's been a huge success. And the other huge success has been our firefighter program. How many of you guys have heard about the firefighter program? Good. You're going to hear about it again. So we have gone to many firehouses in our greater community, especially in Newton and Waltham, and give sort of a crash course, a 3 to 4 part course on how to be heart healthy. Why is this important? By far and away, the #1 killer of firefighters is cardiovascular disease, and a lot of them, how shall I say, are young men with not the best cardiac lifestyle. So we go in and talk about risk factors in general. We give demonstrations on diet and things that they can cook in a heart-healthy way. We give them teaching on physical activity and relaxation, and it's been very, very well received, and we've been now asked back to sort of do this again on a regular basis, so we're really proud of those efforts. And then finally, before I get into innovation, you should know that Newton-Wellesley Hospital has been recognized by the American Heart Association as a center of excellence for atrial fibrillation care, heart failure care, and stroke, 3 of the really sort of big issues in the cardiovascular world. And I think, Larry, correct me if I'm wrong, we're the only hospital to have gotten all 3 of those for 3 or more years in a row. So it's a really great team that we get to work with, and for a community hospital, I think that the clinical services are robust and quite good. All right, I'm now going to shift gears and talk slower about 3 or 4 what I think are innovative programs at Newton-Wellesley Hospital. And again, Larry sort of mentioned one. Lots of studies over the last 20 years have shown that people of South Asian descent, India, Pakistan, and those regions, have much, much higher levels of diabetes, as Jean will certainly attest, and higher levels of heart attack and stroke, despite the fact that they're much more likely to be vegetarian, not smoke, and be a lot slimmer than the average American. There are lots of metabolic reasons for that, but it's been underappreciated, underdiagnosed, and undertreated for a long time. And as a result, these patients tend to develop these issues at much, much younger ages. So after a collaboration and conversation with Ami Bhatt, shown on the bottom right, who's a cardiologist at Mass General Hospital, we decided to put together a multidisciplinary crew here at Newton-Wellesley Hospital focused on these patients. And it basically features the 3 Newton-Wellesley Hospital cardiologists shown on top, in conjunction with a fantastic nutritionist, Mitali Bixby, who speaks 3 or 4 dialects out of the India subcontinent and who's very well versed in cardiac diet, but also South Asian diets. So the way that this works is patients go and see the cardiologist. They then will have time to see the nutritionist with their family for a full hour, and when appropriate, see Daniel Destin, who many of you know is the director of our excellent Shipley Fitness Center, where they get customized exercise prescription. Again, a really amazing cutting-edge program, and I think it's one of only 3 in the country, and the only one, I believe, that is east of the Mississippi. So we're really sort of proud of this program. Oh, and I should mention that all of the innovations I'm about to talk to you about really are under the sub-theme of collaboration and innovation. So in every one of these programs, you'll see how it worked, because not that George or the team at Newton-Wellesley was solely, brilliant. It's because we partner with other people within our system that sort of made it go. And so this is an example of working with MGH and Dr. Bhatt. The other program that I think is really cool is the NWH-BWH dyspnea program. What's dyspnea? It's a medical way of saying shortness of breath. So a fairly large portion of the patients that come into us have shortness of breath, and it's not understood why they do, or fatigue, despite the fact that they've gotten lots of cardiac tests and lots of lung tests. This is a really common scenario. And our pulmonary colleagues, Drs. Waxman and Stump at the Brigham, have a special program and a test called a cardiopulmonary exercise test that actually can help diagnose what the reason is for the shortness of breath or for the fatigue. And they have brought that technology and that clinic over to us at Newton-Wellesley Hospital in the Elfhurst Cardiovascular Center. And I'll give you a quick sort of exposure as to what it is. Patients who have fatigue and shortness of breath that are not explained will go into our procedural area, and then, shown out here bottom left, and they'll have this catheter, this yellow catheter shown on the bottom, placed into a vein here in their neck and then into their hearts. And while the catheter is there, we measure oxygen and pressures and anything that we can measure to sort of see what's going on with the heart and the lungs. We then tape the catheter in, literally, put them in a stretcher, and roll them 50 yards down the hall into our non-invasive lab, where we put them on a bicycle and have them do a really hard stress test. We bike them really hard while we're measuring the oxygen they're sucking in, the carbon dioxide they're breathing out through a mask, and all the pressure. You're making a funny face. Is this okay? It is pretty cool. And then the pressures and the oxygenation in their heart. And by getting this incredibly precise physiologic information, by the end of it, in a large proportion of cases, we can say, was the problem the heart? Was it the lungs? Is it a muscle problem? Is it a neurologic problem? Are they not trying? Or is it something that might have to do with long COVID? There's actually a pattern in long COVID of having some muscle issues and vessel issues that we have picked up with this test. So with a sizable population of folks who were really debilitated by shortness of breath and fatigue, they're now sort of leaving this cutting-edge program with a better understanding of why they're so limited, and oftentimes with sort of new therapeutics to make them feel better. Okay, so again, collaboration and innovation. We did this in conjunction with Brigham and Women's Hospital, and it's been a huge success. The next one to talk about, again, collaboration and innovation, is our Newton-Wellesley Hospital MGH arrhythmia program. So the first weekend that I was on call back in 2014, 16 of the 18 patients that I saw that weekend had atrial fibrillation, an irregular heart rhythm. And it became pretty apparent to us that we were going to be seeing a lot of rhythm problems at Newton-Wellesley. So we teamed up with 2 arrhythmia specialists from the General, Dr. Musa Mansour and Leon Ptacek, and created kind of a one-stop shopping multidisciplinary clinic. So the schema is you come in and you see one of our cardiologists, shown on the left, Dr. Parpos and Coronado. They then, if they feel that you need pharmacologic therapy or a procedure in the Elfhurst Center, a cardioversion or a pacemaker, will proceed with the aid of these 2 MGH arrhythmia physicians. But if they need to go on rapidly to a procedure like an ablation at Mass General Hospital, that's arranged right on the spot after a conference of these physicians and nurses. Aftercare is taken care of by a nurse practitioner and a clinical pharmacist who focuses on the very complicated medicines and blood thinners that these patients use. Now, this sounds simple, but in generally 1 or 2 visits with a conversation between this group all collaborating, that's the theme, amazing therapeutics sort of get done with really complicated patients, okay? Again, I know of very few other community hospitals that have this kind of system put together. And what we're hoping moving forward is one of the high-level procedures, that ablation procedure I told you about, that you have to go into Mass General. There have been some advances there, and we're thinking or hoping maybe that can come to Newton-Wellesley someday. Larry mentioned the incredible CT angiograph machine that we have that allows you to forego a stress test and forego an invasive procedure where somebody has to put a catheter in your vessel and snake it into your heart. Instead, by just going through a simple CAT scanner, like you can see on the bottom right, we get these incredible outlines of the coronary arteries, and that can help us, within a matter of minutes, know if somebody can be discharged from the emergency room or if they need to go directly into town to have their vessel opened. It has been a real game changer at Newton-Wellesley Hospital, and we're using it a lot. It's been great. And then finally, I'm going to end up by two things that don't sound innovative, but actually really are, and that is the relationships that we are building within the different Mass General hospitals and also between the different Newton-Wellesley Hospital divisions, okay? Again, innovation through collaboration. So here's Newton-Wellesley Hospital all by its lonesome, okay? For a while, we have benefited greatly, for many years, of having incredible collaboration and access to Mass General and the Brigham. It has mostly in the past, not now, taken the form of us sending patients to them, bypass operations, high-level procedures. But more and more, certainly since I've been here, there's a two-way movement of talent, and such that a lot of the clinicians there are now part of our staff and work with us. They're embedded in our programs, such that we can offer academic medical center care here at Newton-Wellesley. But there's a new thing on the horizon that you might have heard about it, which is Mass General Brigham has been focusing on coordinating not just a few hospitals near the city, but all the hospitals and the clinics in the greater Mass General Brigham community. We've actually created something called the Community Division. So all the hospitals and clinics, essentially, that are not Mass General and Brigham now meet on a weekly basis. I'm part of those meetings to talk about how we can work together, share resources, and we even send patients back and forth from community hospitals when we have a resource, say the dyspnea program, that another hospital might not have. And this has really upped the game because now I not only have the menu from those two places, I have a full array of resources to offer my patients, and they can get it in the friendly confines of Newton-Wellesley Hospital. So this has been a game changer, and it's only going to get better. Finally, we, Heart in the Center, have been doing, I think, a slow but much better job of reaching out and working with our colleagues in the other divisions. And I think Dr. Blaskowski and Jean are perfect examples to understand that, you know, our patients are their patients are our patients. So Jean and I have been working, and we're going to make this happen, of trying to get a system together whereby all of these very complicated, expensive medicines that our patients should be on, that we actually work together. Our nurse practitioners work together, our doctors work together, the pharmacists do, to create a seamless system. So that for the patient, it's not that I've got to go to this clinic and that clinic. I go to one, they're all talking to each other, and it's much easier for the patient. So that we've been working on that. And similarly, in Larry's role, I don't know if you're going to talk about this, Larry, there's a whole new field called cardio-oncology. Larry is saving so many patients with the new chemos and immunomodulators that they're surviving, but they're having heart problems, sometimes because of the cancer, sometimes because of the medicines. And so you need collaborative people who work together side by side to take care of those patients. Stroke, we mentioned, that's an obvious one, okay? So I think the next cutting edge of innovation, believe it or not, is not going to be any new technology, although we need that too. It's going to be ways that we break down artificial silos, and the three people here on this stage work sort of seamlessly. So I want to sort of leave us on that kumbaya moment.